Welcome to NSG 323, Study Session 4, Choriocarcinoma. Introduction. This study session will discuss the meaning or definition of what is meant by the term choriocarcinoma, its pathology, the etiology or epidemiology, the symptoms or signs, and finally, the treatment. Learning outcomes. At the end of the study session, you should be able to 1. Define the concept choriocarcinoma. 2. Discuss the etiology or epidemiology of choriocarcinoma. 3. Describe the symptoms or signs of choriocarcinoma. 4. Discuss the treatment of choriocarcinoma. Definition. Choriocarcinoma is a malignant trophoblastic cancer, usually of the placenta. It is characterized by early hematogenous spread to the lungs. It belongs to the malignant end of the spectrum in gestational trophoblastic disease, GTD. It is also classified as a germ cell tumor and may arise in the testes or ovary. Choriocarcinoma can simply be said to be a fast-growing form of cancer that occurs in a woman's uterus, womb. The abnormal cell starts in the tissue that would normally become the placenta. This is the organ which now develops during pregnancy to feed the fetus. Description of choriocarcinoma. Choriocarcinomas are cancers that develop from germ cells, cells that ordinarily turn into sperm or eggs. Choriocarcinomas resemble the cells that surround an embryo in the uterus. Most of these cancers form inside the reproductive organs. Some originate in the testes or ovaries, especially in young adults. Others develop in the uterus after a pregnancy or miscarriage, particularly often after a mole. A few choriocarcinomas arise in sites outside the reproductive organs. Such extragonadal tumors are usually found in young adults and are more common in males. Choriocarcinomas are one of the most dangerous germ cell cancers. Choriocarcinomas usually grow quickly and spread widely. Occasionally, this cancer grows so fast that the original tumor outgrows its blood supply and dies, leaving behind only a small scar. Causes. Choriocarcinoma is a type of cancer which is not common but occurs during pregnancy. It is possible for a baby to either develop or not in this type of pregnancy. This type of cancer may occur after a normal pregnancy, and most often that it occurs with a complete iridiform mole as shown below. This abnormal tissue, which is from the mole, can then continue to grow after it is removed and can then turn into cancer. Almost half of all women with a choriocarcinoma usually have a iridiform mole or molar pregnancy. Choriocarcinoma can also occur after an early pregnancy that does not continue, miscarriage, or after an ectopic pregnancy or genital tumor. Pathology. Characteristic feature is the identification of intimately related syncytial trophoblast and cytotrophoblast without formation of definite placental type, villi. Since choriocarcinomas include syncytial trophoblast, beta HCG producing cells, they cause elevated blood levels of beta human chorionic gonadotrophin. Syncytotrophoblast are large multinucleated cells with eosinophilic cytoplasm. They often surround the cytotrophoblast, reminiscent of their normal anatomical relationship in chorionic villi. Cytotrophoblasts are polyhedral mononuclear cells with hyperchromatic nuclei and a clear or pale cytoplasm. Extensive hemorrhage is a common finding. Etiology or epidemiology. Choriocarcinoma of the placenta during pregnancy is preceded by hydatidform mole, 50% of cases, spontaneous abortion, 20% of cases, ectopic pregnancy, 2% of cases, normal term pregnancy, 20 to 30% of cases. Rarely, choriocarcinoma occurs in primary locations other than the placenta. Very rarely, it occurs in testicles. Although trophoblastic components are common components of mixed germ cell tumors, pure choriocarcinoma of the adult testes is rare. Pure choriocarcinoma of the testes represents the most aggressive pathologic variant of germ cell tumors in adults, characteristically with early hematogenous and lymphatic metastatic spread. Because of early spread and inherent resistance to anti-cancer drugs, patients have poor prognosis. Elements of choriocarcinoma in a mixed testicular tumor have no prognostic importance. Choriocarcinomas can also occur in the ovaries. Symptoms, signs, or labs. Increased quantitative beta human chorionic gonadotrophin levels, vaginal bleeding, shortness of breath, hemoptysis, coughing up blood, chest pain. Chest X-ray shows multiple infiltrates of various shapes in both lungs, present in males as a testicular neoplasm, sometimes with skin hyperpigmentation from Essex beta HCG, cross-reacting with the alpha MSH receptor, gynecomastia, and weight loss from Essex beta HCG cross-reacting with the TSH receptor in males can present with increased thyroid stimulating hormone, TSH. Treatment. Since gestational choriocarcinoma, which arises from an hydatidform mole, contains paternal DNA and thus paternal antigens, it is exquisitely sensitive to chemotherapy. The cure rate even for metastatic gestational choriocarcinoma is around 90 to 95%. At present, treatment with single-agent methotrexate is recommended for low-risk disease, while intense combination regimens including etoposide, methotrexate, actinomycin D, cyclophosphamide, and vincristine unconvened are recommended for intermediate or high-risk disease. Hysterectomy, surgical removal of the uterus, can also be offered to patients under 40 years of age or those for whom sterilization is not an obstacle. It may be required for those with severe infection and uncontrolled bleeding. Choriocarcinoma arising in the testicle is rare, malignant and highly resistant to chemotherapy. The same is true of choriocarcinoma arising in the ovary. Testicular choriocarcinoma has the worst prognosis of all germ cell cancers. Summary. At the end of the study session, you have learnt 1. The definition and meaning of the concept choriocarcinoma. 2. The etiology, epidemiology of choriocarcinoma. 3. The symptoms and signs of choriocarcinoma. 4. The treatment of choriocarcin. End of study session 4. Thanks for listening.